Hi, welcome to In a Heartbeat. I'm your host, Joan Patrick Morris. In a Heartbeat today, I have the pleasure of interviewing three key staff over programs, a few of the programs at the Children's Center. As you know, the children are 85 years old. They are in the city, located in the downtown area, and they have probably over 20 plus programs last time I checked. But today I have the pleasure of interviewing the Crystal Coleman, Clinical Director for the Crisis Care Center, Deana Fisher, Director of Child Welfare, and in the second half of the show, I will be interviewing Dr. Kara Brooklier, pediatric neuropsychologist. So they will be coming from different perspectives and to talk about some of the really interesting things and programs that they have at the Children's Center and how we all may get involved. And of course, near the end, we'll talk about how you can help the Children's Center. Please help me as I welcome Crystal Coleman, the Crisis Care Center.
Mm-hmm.
And you are the director there.
Yes.
And then Deana Fisher, Child Welfare, which we could talk about forever, the foster care and all of that. She's going to tell you all the wonderful things. So, Crystal, help. You are the director of the Crisis Care Center at the Children's Center. So, elevate awareness of the Crisis Care Center is this something new? Have you always had this?
We've had it for about 2 years now.
2 years.
Going
okay.
into our third
Mm-hmm.
year.
Mm-hmm.
And it was really put into place as an alternative for our children in the community going to the emergency room when they had a psychiatric crisis, where, of course, all sorts of things are coming through the emergency room, from violent crime victims, very ill children who are screaming and yelling. And so we had our clients who were in a pretty sensitive state going to that same area for treatment. And because it's an emergency room, they were spending hours there before they were getting the services that they need. So the Children's Center partnered with Wayne County Community Mental Health, and we developed this program that will give them a safer, more appropriate space handling those sensitive symptoms and situations within the family.
So, if I understood you, work with the hospitals. Do you work with hospitals? How do they get referred to you?
We're actually a walk-in program.
Oh, really?
Yeah, we never know when a crisis is going to happen.
Okay.
Sometimes the family doesn't expect it. So we're walk-in basis during our operating hours. We're open from 8 a.m. until midnight, Monday through Friday, so that we're covering hours when the agencies are not open. A lot of times during the school day for children, and the school's primary way of handling situations like that is to have the child transported to the emergency department. So we're open during school hours. We're open in the evening so that we're available when the families need us to be.
So can you kind of walk me through? A child comes in, there's a crisis. Someone evaluates them and kind of walk us through, and then you refer them within the Children's Center, maybe. And then if it's really acute, I'm assuming, and because it's a crisis.
It's a crisis.
So a lot of times then you refer them where they need to go.
Right. We have several options. I think what we do a little bit differently at the Crisis Care Center, though, is that when a family presents, our goal is to settle the crisis with the family and return the child home safely. Like, we really want to be able to resolve whatever the issue is that brought them in. So what my staff does there, we have master's level clinicians, and they work with the child, they work with the parent, and whomever else shows up with that child, and really try to help the family pinpoint what happened that this crisis arose for them. So sometimes, it may be, a lot of times it's, because the child has threatened to kill themselves. Maybe, partook in some self-harmful behaviors, and the family really needs some assistance. So what they do is work with the family to find out, why did the child do that? How did we get to this point? And really try to put some safety measures in place so that the child can go back home. So that's our primary, the family, to keep them united. We don't want them separated during a time of crisis and to return home. When we cannot do that, when we've exhausted, all possibilities, then we do have some options to send the child either to a day treatment program where they'll spend most of their days and go home in the evening, or a crisis residential where they'll stay for a couple of weeks. The family can visit. They're getting treatment there. There's a psychiatrist on staff. There's a clinician there, treating the child. And then they'll go home for after a couple of weeks or so. And as a last resort, if we cannot ensure safety with that child, we will be able to authorize inpatient hospitalization for them. And so even when that's the last resort, we have to prepare the family for that, talk them through it, help them understand exactly why that's the route that we need to take and how it will impact them over the next few days. Mm-hmm.
So if I'm understanding you correctly, you actually put the disciplines in that they need, and put them in the programs that they need.
Correct.
And correct me if I'm wrong, inpatient mental health is, they're usually just short stays, and the health insurances and things, they're not covering long term. It's really interesting because I've been seeing lately on television how our mental health system is broken, and I remember the days when we could actually, people that had behavioral health issues were able to stay inpatient and, not be treated outpatient or incarcerated,
Correct.
When there's a really mental illness going on.
Right.
And I'm so glad that that's coming back to surface. I can't say it enough because, I remember when I was starting out in my nursing, and for many years, we were able to place people in an institution so that they would get the care that they need, and then when we felt comfortable, we were able to place them back into the community. So I really admire the Children's Center for taking that on and for it to be 2 years old. How many clients have you seen so far?
Interesting, you should ask that. So we're at the end of the fiscal year, and so I was looking at a few numbers the other day, and we saw close to double the number of children this fiscal year than we did last year. So we've serviced in total in our 2 years there close to 700 children.
Really?
Children
That is
of
awesome.
Mhm.
I mean, that's great because, and I'm assuming the more awareness that comes out. Now, is that a covered benefit in the insurance? Okay. And it comes under.
Well, most of the children who we see are covered under Medicaid.
Okay.
And community mental health services.
Okay, so that comes under that.
So that's where most of our population from. But Children's Center is paneled with most private insurances.
Yes.
So as long as the family has private insurance coverage, we can see them at the Children's Center as well.
I want to talk to Deana. Deana is the director of the Child Welfare Program at the Children's Center, and she's going to talk about the adoption and the need for more people to consider taking on the adoption of many children that need a home. So, Deana, share with us the Children's Center. The foster care program has been there for a long time.
Long time, yeah.
Long time.
Yeah, and I've been there almost 3 years directing the program. Right now we have about 200 kids from 0 to 21 in care with us. But there are 13,000 children in foster care in the state of Michigan, and approximately a third of that number is in Wayne, Oakland, and Macomb County. So in Wayne County alone, there's about 2,500 kids in foster care.
Really?
So it's a very big need. We always have more kids to place than we have homes to place them in.
Wow. So, I mean, parents, and can you provide some examples of how children get placed into, we can all assume, from abuse and things like that, but there are other reasons that children are placed in foster care. So you want to share with our viewing audience, because, we may be just thinking that there are just a few things, but there are really quite a number of
There's
issues
quite
that come
a
up.
number of factors. And Michigan has done a great job of not taking children out of the home for things that you could easily solve, like We used to remove kids if there was no water or no heat. Now we have programs that will help get those services back on. So what it really comes down to now is poverty plus mental illness that's untreated in the family, in the parents, or poverty plus alcoholism or substance abuse, or any combination of those three factors. Because if a child is just because of neglect issues, because of things outside the family's control, we can help the family with that without removing the children. But often you have adults, parents with untreated mental illness, untreated substance abuse, and until you can stabilize the parent, they can't be effective in parenting the children. So we remove the children for hopefully a brief period of time to allow the parents to get the treatment that they need for whatever else is going on, to relieve their stress, because we know if they're using substances, a lot of times it's to self-medicate their own stress levels. Remove the kids, help with those, reduce those stress, get the parents in treatment, and then reunify the kids back home.
You see. Crystal, I want to, let's put up how you can contact Crystal at the Children's Center in case there's a crisis. Did we show that? Has that been shown? I'm hoping that we have put that up there. We're going to take a break, and I'm going to talk to Deana Fisher, the Director of Clinical Child Welfare. Then the second half of the show, we're going to bring on Dr. Kara Brooklier, the pediatric neuropsychologist. So stay with us, and we'll be right back.
Yeah.
Hi, welcome back to In a Heartbeat. I'm your host, Joan Patrick Morris, for the second half of the show. The second half of the show, I have Dr. Kara Brooklier, pediatric neuropsychologist with the Children's Center. Hi, Dr. Brooklier. Before I come over to you, I want to just ask Deana Fisher, Director of Child Welfare. Deana, how do you when you're treating the parent, it's a whole family thing. It's a whole family care coordination, discipline, and the whole idea is to bring the children back, keep the family together.
Correct. So what we do is we establish a treatment plan for each parent,
Right.
mother and father. It may include things like attending parenting skills, going to substance abuse treatment, getting therapy, whatever it is that their issues are that are keeping them from being able to parent effectively. It's our job to hook them up with the resources to be able to overcome that. And in addition to that, they're visiting with their children weekly, sometimes twice or even 3 times a week, depending on. And then we help them to achieve their goals. Now, if the treatment plan is met and the goals are achieved and they've benefited from the services, then we will move towards reunification with the kids. We usually start with overnights and then, more long-term. If it looks like the parents are really struggling and it's going to be a long-term care, we're always looking for relatives to come forward so that we can keep the child, if not with the biological parents, at least with a family member, so grandma, auntie, cousins, whoever we can come up with. So we do really deep dive searches in both maternal and paternal relatives to see if there's some way we can keep the child in the family, even if they can't be with the biological parents.
Okay, so another scenario, when things just look like they're just not going to work out, where they can be reunited.
Right.
That is where you really are looking for your foster care parents to come in and to step in. Have you had a really good success rate? But I think you did say pretty much within Wayne County you do get some foster care parents to step up and they do have a support system.
Parents are really necessary. While the parents are trying to heal their issues, the children have also experienced, they're grieving, and so we need a foster parent who has a real passion for children and take that child and help them to heal from all of the issues that they've experienced. They have to be prepared to have a very angry child, a very sad child, a child that doesn't understand because they grew up in this environment, so they don't know that there's something wrong with that. And then they are taken in by foster parents, and the foster parents have to help that child grow and develop so that when they are reunited, they're not taking all of that grief and loss and trauma back into the home with them.
Right.
And so we need foster parents for that. And then if the biological parents can't do what they need to do to get the child back, then the foster parents usually end up adopting the children.
Oh, that's nice.
Yeah.
That's nice. And then there's a training that you have,
Yeah.
and you have a blog. You want to just tell, you have a blog that if you're interested, because there is a need for foster parenting, I think you will be surprised. They do there's a training that's offered, and you have a really good support system. You don't just, I think I'll be a foster parent, and so they really prepare you for that, and you have a really good support system.
Right.
So if I'm understanding correctly, they can visit the blog and the website to learn more about foster parenting and get involved and help out some of these children so that they can be wonderful citizens and contribute back into the community.
Right. We heal a family, we heal our community, and we can only heal our family if we heal these children and then every child we reunite helps the community. It's a healthier family.
Right. I'm going to come back to you if we have some time, but Dr. Brooklier. So Dr. Brooklier is the pediatric neuropsychologist at the Children's Center, and I know one of the programs she's over is autism, but I'm going to let her tell you what she does and what you can do. I will help her too to support the Children's Center. Dr. Brooklier.
Hi.
So you want to elevate the general public about the ASD and what to look for. And ASD stands for?
Autism spectrum disorder, and we're really trying to focus on early intervention and getting kids in for early diagnosis. The average age of diagnosis in the country at large is around age 4, and if we look at children that are in inner cities or children that are of low SES status, low income status, we see that the age of diagnosis is upwards of age 7. That critical window of intervention is really prior to age 5. So we're really trying to get kids in during the early ages to be able to get them diagnosed and get them proper intensive care. So what we're trying to do is really focus on the 1 to 5-year-old population to get the intervention going.
The Children's Center Autism Program is it less than a year old?
The program has been a part of our developmental disability services that have been long-standing at the Children's Center.
Okay.
But when we really tried to heighten our early intervention program, we created an offshoot from our developmental disability services to have a specialty program for children with autism, again, so that we could really focus on the intensive behavioral interventions that are very effective for those kids.
I see. Now, and they have, the Children's Center it's a separate building. It is, what is the address there for?
101 East Alexandrine.
Yes, and so they have, and it's everything is devoted to
Developmental disabilities.
Developmental disabilities. And so you talked about, help the audience understand a little bit more early intervention. That is key. So does a child at 2 years old, are there signs that that a parent can detect that maybe something is not right?
Absolutely,
yeah.
Absolutely. And interestingly, if you talk to parents, even whose children were diagnosed at a later age, most of the time they can reflect back and say, I had concerns about my child, around age 1, 1.5, and we really are able to reliably and accurately diagnose kids as young as 16 to 18 months. Signs and symptoms that parents want to be on the lookout for are limited eye contact. Babies really like to gaze at faces, so if a baby's not looking at mom's face, dad's face, other caregivers, that's a pretty significant sign. The other thing is a preference for being alone, so instead of wanting to share and show and pull individuals' attention in, often children with autism are much more likely to be solitary players. Other things that we look for are some of the more unusual symptoms that we see for autism, things like hand flapping or other repetitive behaviors. But again, the early signs tend to really be the social ones. So the lack of eye contact, the lack of show behavior, and the lack of really wanting to include mom and dad, interested in other kids, into their activities.
now that you guys drafted, tell me about the drafting of the legislation for this, because it was really a difficult time getting to get where we are now with autism. Am I right?
Absolutely.
I mean, it was like, so now it is a covered benefit for most health insurance. Although I understand about the commercial part, you can add that on as a benefit, but for people that have Medicaid, that it is a covered benefit. And a lot of us have commercial and we have the Medicaid, so you can have, a lot of times you have both. But it is a covered benefit.
It is, and that's been something that I've been particularly passionate about, and the staff at the Children's Center in general have been passionate about, is making sure that children that are Medicaid eligible have the same access to early intervention care that kids that have commercial insurance do. So I was part of a state task force group that helped to draft legislation that wrote the policy documents that got federal approval for federal Medicaid for us to be able to provide this early intensive intervention, which is called applied behavior analysis, or we often refer to it as the ABA. And what that is a specialized care that's provided upwards of 20 to 30 hours a week for kids who need it. And what we do is really break the skills down into the micro behaviors so that kids that are having difficulty learning how to engage, learning how to learn, learning how to talk, we make those micro behaviors and teach them step by step so that they can get there.
Wow, that is awesome. So you've got the Autism Center, and just if the staff consists of course, you're the neuropsychologist. You also have a medical director?
Dr. Cecilia Storga, she is our Chief Medical Officer, and she is a wonderful woman with whom to work. She's a powerhouse, and she definitely has helped to, allow us to expand services. And she also provides herself and her staff psychiatric care to children who need it, that are on the spectrum or who have an intellectual disability or any kind of clinical need.
Right. And the parents, I saw when I did the tour, the parents seemed so comfortable there when they were I attended the open house, did we do that, was it this year?
It was last spring.
Last spring.
Yeah.
And it was just really something, and the warmth that the children felt and how they felt at home. They were all over the place. The parents were extremely comfortable. So, I mean, and the parents came from just all over. I mean, it was just really very rewarding. And I really recommend that you take some time to do a tour at the Children's Center. But the staff consists of, okay, so you've got the neuropsychologist, but you've got other people on the team that make up the team.
Absolutely. So at the top of the team are, those of us that are on the diagnostic end, so that's myself and the other psychological staff. And then we have our behavioral staff that are doing interventions, so that's our social workers, our BCBAs, which are behavioral specialists, and they're doing the behavioral interventions with the children. And then we also have support coordinators, which really just help support not only the child but the family in being able to service any needs that they may have. So our support coordinators help with issues of housing, if they're having struggles there, that help with school coordination, and they'll also help the families get connected with other services that they might need, be it medical, speech, or occupational therapy.
That's awesome. I hope that you will consider making a contribution, volunteering at the Children's Center, and just doing a tour. I mean, you will be amazed. It's like a campus. It's not like a campus. It is a campus. There's the Alexandrine side, and then there's the side that you're on. That's Alexandrine too, right?
Yep, we cross Woodward, both sides of Woodward.
Both sides of Woodward. So, I mean, it's just really amazing, and I think you will find it really, really rewarding. They've got some special events coming up, the Tour de Fork. We're going to put that up on the screen. You will love it. It's at the School of Creative Studies this year. They've got, let's see, what was the other one?
Detroit Uncorked.
Yeah, Detroit Uncorked.
Coming up.
At the book, Cadillac. Awesome. And you can always just go on the website and find out how you can make contributions to the Children's Center and consider them when you are deciding on your charitable donations. They welcome them. They do get funding from the state, but as you know, it is never enough when you are working with children. And I want to thank Crystal Coleman, the clinical director for the Children's Center, for coming on the show today. I want to thank Deana Fisher, the Director of Child Welfare, for being my guest today. And I want to thank Dr. Kara Brooklier, the Pediatric Clinical Psychologist, for sharing with us the autism program and all of the wonderful things that the Children's Center does. They have many programs. The foster care program, please consider being a foster care parent. Just make an inquiry about it. It's a need. It's a rewarding need. Am I right, Deana? It's
Yes.
a rewarding need, and we welcome you. I'm your host, Joan Patrick Morris. Thank you for watching this segment of In a Heartbeat. Have a wonderful day, night.